Welcome to IRG's Sports Injury Update. I'm with Shannon O'Kelly, physical therapist and president of IRG Physical and Hand Therapy, and our guest, Dr. Mia Hagen, orthopedic surgeon specializing in sports medicine at UW Medicine.
Dr. Hagen, welcome. You're an orthopedic surgeon with a fellowship in sports medicine at the University of Washington. You see a lot of hips. Tell us about hip impingement.
Hip impingement is something that we also call femoral acetabular impingement, or FAI syndrome, and it's pain in the front of the hip resulting from certain types of motion that the hip might go through.
Signs and symptoms are pain, dysfunction with certain activities?
Exactly, yeah. For example, getting in and out of a chair or a low car seat, bringing your hip up into flexion.
Certain population more susceptible?
I would say the younger gentlemen who played sports their whole life are the higher risk population.
How do you diagnose it?
Diagnosis is based on their exam findings as well as some imaging. If you can reproduce their pain with certain motions of their hip, then that's a pretty good indication.
What are some of those imaging findings?
The hip normally looks like a ball and socket joint, but on those x-rays you may see a bigger bump on the femur side, or the acetabular or socket side might be overcovered.
So some asymmetry.
Exactly. And then on MRI you'd see a labral tear.
Tell us about treatment.
Treatment for the hip involves, first, of course, a physical therapy to see if you can iron out some of the mechanics of the hip joint. If that fails, you can try injections into the hip. And then, of course, the last resort is surgery, which does work well for this condition.
What are the outcomes in return to play for most of these athletes?
Typically, we say minimum of 6 months because there's a lot of recovery that goes into this process. The labrum has to heal, and they have to build back their mechanics and their strength in their hip.
If you want more information regarding hip impingement or other sports medicine injuries, you can contact Dr. Hagen at uwmedicine.org. That's uwmedicine.org.
With over 40 neighborhood clinics around Washington, IRG has you covered. Let IRG be your family's physical therapist. Find the location nearest you at irgpt.com. That's irgpt.com.